everyone, welcome back to JDCN Forum 2020. I hope everyone's doing well and had a very good lunch. So now let's get down to business and discuss our next topic about public health. The theme is society's health conjecturing life during and after the pandemic. COVID-19's pandemic has undoubtedly become such a test for all policymakers in addressing public health, a policy that is affecting directly to socioeconomic activities of society. The world is once again on the edge with a new pandemic after a long century, and our leaders are being tested like never before. Evidently, Jakarta has shown progressive developments as we mitigate COVID-19's pandemic with continuous active testing and tracking, accommodative health facilities, and bold policies such as strict large-scale social restriction or PSBB based on scientific and medical expert advice, and the list goes on and on. And Jakarta is not working alone. A collaboration with multi-stakeholders has helped Jakarta significantly in mitigating the pandemic.
In the middle of the COVID-19 pandemic, Community Health Center or Puskesmas is not only a place for public health service. The government of Jakarta make Puskesmas as one of the strategies for overcoming COVID-19. Pandemic also encouraged Puskesmas to transforming health service to start activate digital service. At the Tebet Puskesmas, for example, to reduce direct contact, they use social media platforms such as YouTube channel to serve posyandu for toddlers.
Kemudian kita mencari bentuk baru atau mencari inovasi supaya layanan kepada masyarakat ini tetap bisa berjalan, tetapi tetap aman buat masyarakat dan petugas. Contohnya, di kami posyandu itu kita ada namanya posyandu yang mandiri. Gitu, layanan posyandu mandiri, artinya kita membuat video tutorial awalnya nih ya, kita membuat video tutorial kepada ibu-ibu balita, tujuan ibu balita, tentu kita sudah berkoordinasi dengan kader dengan PKK ya. Kita membuat video tutorial bagaimana ibu ini dilatih supaya dia mampu untuk melakukan pengukuran tinggi badan, berat badan pada balitanya di rumah. Gitu ya, dengan alat sederhana.
Not only that, Tebet Puskesmas also developing upper respiratory tract infection screening service or ISPA. Before conducting the examinations, visitors who have respiratory complaints will immediately receive a screening. If needed, the follow-up is immediately carried out with a swab test and will be separated from other patients who want to check themselves with different complaints. This system is appreciated by many people who feel safe going to Puskesmas.
Bagus, baik, dan sangat membantu sesuai bagian dan tupoksinya masing-masing, dan juga diarahkan sesuai dengan standar, terus dipisahkan, jadi yang bergejala batuk dan flu dipisahkan, terus yang anak balita dipisahkan, segala macam itu. Terus untuk screeningnya COVID juga dipisahkan juga.
It is must to say, Puskesmas play a big part to prevent the spread of COVID-19 in Jakarta, which effectively carry out contact tracing functions, conduct independent isolation tests, monitoring, guidance and education functions at the community level.
So let us get down to business and start our discussion on public health. But first, let us say hello to all the participants here present with us after lunch. Hi, everybody. I hope everyone's doing well. I'm so happy to see so many participants present with us on this session on public health. I'm sure that we've all been gaining so many insights from our speakers on the previous sessions, and now we're going to pick more brain on for our next session with our next speakers. And on behalf of our host, we'd like to thank everyone for your participation here today. And for those of you who would like to ask questions during our speakers' presentations, for those of you on Zoom, you can go right ahead and write your questions on the chat box located just below the big screen. And for those of you watching on YouTube, you can ask the questions on the comment section. So once again, everyone, we thank you so much for being with us. And now, let us lead our discussion on public health. We have Ms. Archisha Rashid, a policy manager on health on Jakarta's Governor's Delivery Unit. Archisha will be the moderator for the public health as a policy manager. I'm sure that you've had such a tough challenge this year being a policy manager. So you are definitely the person to moderate this session, Archisha, and the floor is yours.
Thank you so much, Amelia, for the nice introduction. And I would like to greet our speakers today. Good afternoon, Ibu Suharti, who are live from the Balai Kota or the City Hall. And good morning to Professor Tiki Pang. And good morning as well to Mr. Arno Bernard, who are, I think, joining us from Switzerland. So I believe that the previous sessions, as well as just my profession as a policy manager on COVID-19 and health in general under the Governor's Delivery Unit, the pandemic has brought us several fundamental issues to the surface, right? And I think I would just like to start the conversation with these three ponderings. The first one is how can we anticipate the end of the pandemic? Perhaps Professor Pang can answer this most lucidly in the sense that would vaccine be the end of it all? That's the first question, and I think that is the curiosity of everyone here. And then the second question would be definitely for Professor Pang as well as Ibu Harti, how can we build and sustain a resilient public health system, one that can respond more effectively to future pandemics, for example? And when we talk about the word resilience, we go beyond just mere health. Why? Because what we perceive and categorize as perhaps environmental, climate change crisis, or even economic crisis are indirectly or directly pose a potential crisis in public health. Even the question of investment, for example, which investment portfolio to prioritize and how much of the regional or the national budget should go into healthcare or even clean water and sanitation, this will all define the future of public health. So lastly, this brings me to my final and last question that I think will be addressed today by all three speakers. The questions would be, what kinds of innovations as well as collaboration would be most strategic and most relevant for a city as urban and as dynamic as Jakarta so that we can all strengthen our public health measures? To answer all this, it is my honor to introduce and invite our three leaders today from such a diverse fields of expertise. First of all, we have our home team representative, one of my direct reports at work, Ibu Suharti. Ibu Suharti is Jakarta's Deputy Governor for Population and Settlement Control. She received her doctorate in demographic studies from the ANU in Canberra, Australia. Today, she will answer the first and second ponderings, which are how is Jakarta's collaborative approach and challenges face in handling the pandemic. The second one would be what would be the key potentials for policymakers to explore urban health issues after the pandemic, for example. Our second speaker, Professor Tiki Pangestu, or Professor Tiki Pang, is an Indonesian native. He is now a visiting professor at the National University of Singapore School of Medicine, and he had spent most of his career abroad, lastly as WHO Headquarters Director for Research and Policy. Hello, Professor Pang. Professor Pang would answer our curiosity on how to address this question of when would be the end of a pandemic. Is it an epidemiological standpoint when a herd immunity is achieved, or is it going to happen faster or earlier than that? And then, of course, Professor Pang would paint us a clearer picture on the global understandings of COVID-19 as it stands now. And last but never least, our final speaker, Mr. Arno Bernard, is joining us from Switzerland right now. He is the Executive Committee member and head of Health and Healthcare from the World Economic Forum. And previously, Mr. Bernard, I'm sorry, why is it always Professor? Mr. Bernard has also served as leading executive at Philips. So with his leadership at the WEF as well as Philips, he is best suited to talk about how he has launched defining public and private coalitions on future as well as existing health and healthcare industry. So without further ado, I would give the floor to our home team representative, Ibu Suharti. Ibu, the floor is yours.
Thank you, Altricia, for the introductions, and I'm very honored to be here sharing the stage with such illustrious speakers, Professor Pangestu and Mr. Barnett. It is a pleasure for me to speak about the initiatives that the government of Jakarta has taken during the pandemic and why our broader visions for urban health is getting more relevant today, more than ever before. And Jakarta, we know that is miniatures of the nations and the first epicenters of the COVID-19 pandemic in Indonesia. As a city with more than 10.5 million citizens, even 14.5 million during the day due to the commuter, Jakarta is a place where people closely interact with each other. And in a nutshell, it is not easy to handle the pandemic in the city with such traffic. And the first COVID-19 case in Jakarta happened in early March 2020, but starting in January, 2 months before, we had anticipated the pandemic to enter Jakarta. We have launched various actions to mitigate the pandemic by noting 3 principles: factuality, urgency, and collaborations. The first one is the principle of factuality. The city government commits to providing factual information, verified by and consulted with experts, as well as transparent without undue censorship for our citizens. And all policy options also formulated day by day are made based on the valid evidence. The second principle is urgency. All measures taken shall take into account the urgency as deemed necessary according to the most up-to-date conditions. We must save lives anyway. And the third is the principles of collaborations. We know that the crisis accelerates rapidly locally while simultaneously affecting the entire world. So realizing this, the city government has welcomed and actively engaged the participations of various stakeholders. We receive enormous support not only from central government, from local stakeholders, but also from the international partners. And we are far from the finish line. The struggle for overcoming the pandemic continues. And the government has consistently been conducting efforts to mitigate the pandemic. The broad and primary strategy consists of the always treaties, testing, tracing, and treatment. Our testing capacity is continuously improving. The current rate is about 8 per 1,000 population, which means 8 times of the WHO's recommendations. And we are also actively doing tracing for any recorded case with a tracing ratio of 6:1, or on average 6 close contacts are tested for every confirmed case. And we also conduct active case findings, particularly in places with high risk of COVID-19 transmissions. For the treatment side, Jakarta has set up 98 COVID-19 referral hospitals with almost 900 ICU beds and also over 6,500 isolation beds dedicated to COVID-19 patients. While we still actively recruit more health workers to work for us. So how long will our struggle last? Indonesian Red Cross estimated if the vaccine will be distributed starting mid of 2021, it is possible that Indonesia will fully recover by 2022. But on the other hand, WHO has warned that we should prepare for the next pandemic, calling it a fact of life. The world should be better prepared when the next one comes, and we all know that the city is among the most vulnerable. So pandemic is our wake-up call to invest and collaborate in promoting urban health. The government needs to set up an integrated schemes to build a more resilient Jakarta. The costs of vulnerability from the pandemic are fast and heavy. Like what the Gates Foundation said, it is estimated that 25 years of development progress has been wiped out within 25 weeks only. So policymakers should redefine their perspective on the urban health. So I would like to say that Jakarta aspires to be like Singapore, for example. But not merely the modern, sophisticated health facilities only. We want to see more holistic views of urban health. The first thing to do is to shift our paradigm from healthcare which highlight the curative to caring for health, which prioritize the preventive and promotive. Around 70% of health gains could be achieved from prevention by establishing cleaner and safer environments, promoting healthier behaviors, and addressing related factors behind what cause disease and what would promote good health. So with this new paradigm, urban health should be perceived as the sole responsibility of a health agency and hospitals. Instead, it is the responsibility of all stakeholders to promote healthy lifestyles in our society. So from healthy food to clean air, from green space to bike lanes, every single program should include urban health determinants in its planning, and people's increased health is determining the measures of success. And technology is another opportunity. The familiarity of citizens of Jakarta with technology and the growing tech ecosystem is a key factor to support the shift. The pandemic even accelerated the adoptions of digital technologies like never before. It is an opportunity for the government then to encourage and incentivize any innovations which support the improvement of urban health. And we know that Jakarta is the hometown of most Indonesian startups. Therefore, the ways with which the government should encourage, support, and most importantly, collaborate with them can be a good start to reach this vision. And furthermore, urban health is within the interest of all citizens. In fact, it is our human right. So I invite everyone to take part in collaborating with us, whether you are from private sectors, academia, or even civil society. This is what Jakarta Development Collaborations Network is all about. And with that, let me stop here. This talk is just a mere beginnings of what I hope can spark in productive conversations toward a city that is governed based on urban health principles. Thank you very much, and I look forward to exchanging ideas with Professor Pangestu and Mr. Barnett, and welcome further thoughts from the audience. Thank you, Artesia.
Thank you so much, Ibu Harti. I think it is very pressing and urgent to note that just this pandemic alone has wiped out the 25 years of progress in health and healthcare that cities, not only Jakarta, but I think also globally have strived towards. So I think you've done a very great job in painting how the principles of actuality, urgency, as well as collaboration help Jakarta to propel ourselves forward beyond the pandemic. But this sparks my curiosity. You've painted a very lucid picture of the happenings in Jakarta right now. I would definitely be excited to hear what would be the global landscape right now. And I think we should hand over to our second speaker, Professor Pang, who would give us a note on that. Professor Pang, the floor is yours.
Thank you very much, Artesia, and hello to everyone. What I'm going to do is to try to address 5 key questions that I have been asked to address. The first question is, what is the situation with the pandemic globally? Obviously, I think you know that it continues unabated in many parts of the world, especially in Western Europe and in North America. And there is quite a bit of worry in those areas about what might happen after the Christmas holidays, the possibility of a third wave. I think Asia, for example, Singapore and Thailand, they continue to do quite well in managing the pandemic. But as you also know, they have also seen some recent problems or fires or outbreaks, localized outbreaks, for example, in Korea and currently in Japan. So countries who have done well cannot be complacent because there is always the possibility of small outbreaks happening locally. While the Jakarta government, and as Ibu Suharti outlined, is doing well and very, very committed to controlling the pandemic, Indonesia as well as the Philippines as a whole, still has quite significant number of cases on a daily basis. So I think those two countries, Indonesia and the Philippines, will continue to have to work quite hard to control the pandemic. So that's sort of a quick overview of the global situation. In terms of doing something about it, we also obviously need sort of multi-stakeholders to be involved, as well as what Ibu Suharti mentioned, an integrated holistic approach. And these multi-stakeholders include the government, the private sector, the media, as well as civil society, as well as communities. The second question I've been asked to talk about is, what is the impact of the pandemic on the health sector, and what sort of to pay attention to? The worrying impact actually is, because of COVID, there is a diversion of resources, all right? And this results in other diseases being neglected. Many countries in the region have, for example, seen increases in cases of dengue, other diseases, TB and malaria. So that's the worrying impact. We have seen a decline in childhood immunization rate, increase in mental health problems, okay, delayed treatment and care for cancer patients. So that's the worrying impact, diversion of attention as well as resources, so that other diseases either go up and care of patients get neglected. So this obviously means that you have to be prepared for this. You have to anticipate that these things might happen. And as Ibu Suharti mentioned, what is clearly needed here is a resilient and sustainable public health system. Just quickly, the third question is, what is the possibility of an outbreak occurring because of this reduction in childhood vaccination and child development monitoring? This is a definite possibility. If childhood immunizations fall below a certain level, there will be real risk of childhood disease outbreaks. The first example and the best example is probably measles, which requires a 95% vaccine coverage. So if it falls below 95%, you are going to have outbreaks of measles amongst children. And as we all know, that is a serious disease, okay? And it is not just measles. There are other childhood illnesses, such as pneumonia, diarrheal diseases, for example. And importantly, of course, these diseases will affect child development. There is good evidence, for example, that if you have increase in diarrheal diseases among children, it will result in stunting of these children, which, as we know, is a real problem in Indonesia. And stunting will affect intellectual as well as physical development of these children. So both of these, childhood immunization and child development, needs to be monitored during and after the pandemic. The fourth question is the one that Alicia already alluded to. How will the pandemic end? What will change permanently in our life and the way we see public health? My answer to this is that the pandemic will not end as such, okay? The virus will not just disappear. The most likely scenario will be the virus will become endemic, and we will have to learn to live with it. We will have to learn how to manage it, okay? And to sort of not so much try to eliminate the virus, but be prepared for local, if you like, fires or outbreaks. And as Ibu Suharti mentioned, react quickly, transparently, based on data. And what you need here is obviously a platform for open dialogue between scientists, researchers, public health experts, policymakers, and society. So obviously the way we work, live and learn and play will permanently change in many ways in this sort of new normal. And hopefully we will see public health as a critical component of human security. The final question is the big question. Will the vaccine answer or end the pandemic? How effective does a vaccine need to be to stop the pandemic? My answer to this is that a vaccine, whatever vaccine you choose, will certainly help to manage or end the pandemic. But please remember, it is not a magic bullet. We continue to have to pay attention to the use of proven public health measures. For example, using a mask, social distancing, banning large gatherings, and importantly, maintaining social responsibility. And this is another important issue. We need communities and populations to do their part to implement those public health measures. So in the context of how effective vaccine needs to be, I think WHO has basically indicated that COVID vaccine would probably need to reach about 70% of the population to sort of reach what is known as herd immunity, and in this way somehow end the pandemic. So Alicia, so those are the 5 questions that's been suggested to me. So back to you, and look forward to any questions that may come up later. Thank you.
Yes, so thank you so much, Professor Pam. I think I would like to just summarize or point at 2 very profound statements that you gave just now. The first one being that we have to take really a good note on the fact that with the diversion of resources both in terms of financial resources, time, planning, as well as manpower from all the other things that we usually take care of during the business as usual towards COVID-19 approaches, have led to a decline in both the resources, but also it leads also to an increase in both accompanying derivative as well as non-related health risk. So that's definitely number 1. And then number 2, I think you also note how let's not hope for the vaccine to end so quickly. Let's not hope for the pandemic to end so quickly, or the vaccine to be the answer and the end all of the pandemic. But we have to change the urban health and the public health landscape as a whole. So I think this would provide a very good bridging or segue to Mr. Arno Bernard, who will walk us through how P2P or public and private sector collaborations, as well as innovation, can help us strengthen our public health efforts. Please, Mr. Bernard, the floor is yours.
Thank you very much, and thank you, esteemed colleagues. I'm very pleased to be invited today by the Jakarta Development Collaboration Network. Thank you, Artricia. And just a few words on the World Economic Forum. The World Economic Forum is an international organization for public-private partnership, and it has been created already 50 years ago. And we stand for our brand, but also we're known for the Davos event. And that's really in Davos on the 24th of January this year that we started to have alarm signals, and Dr. Tedros from WHO was returning to Geneva in an emergency to attend an executive board meeting where actually the epidemics was declared in a way. And but the forum is more than Davos. Actually, for the past 2 decades, we incubated organizations like the Global Alliance for Vaccination and Immunization that was launched in 2000, and more recently, the CEPI instrument, which is the Coalition for Epidemics Preparedness, Innovation, and CEPI, has been launched in 2017, has been very instrumental in the response to the crisis. And when we talk about response, I think it's not like we had no way to anticipate it. If you look into the past 2 decades, we have seen 8 outbreaks of epidemics. I would mention SARS, H1N1, MERS, Ebola twice, Zika, Lassa fever, and now coronavirus. By the way, this coronavirus is known in animals for 2 decades. So there is a fundamental flaw in that we had no preparation to these particular epidemics. Keep in mind, I think 75% of epidemics or new infectious disease are linked to animal diseases, most likely linked to climate change. So that was a phenomenon that was highly predictable. And if you look into the Global Preparedness Monitoring Board report that was incubated, the GPMB was incubated since 2018 as part of WHO. If you look at their report dated September 2019, I think you would see precisely what was going to happen. I mean, this report was premonitory, highly predictable. Now, the healthcare systems globally, we knew were not very sustainable. We've seen that they are costing 11% of the global GDP, and the growth in expenses and spending is twice the one of the GDP growth level globally since 1950. So the cost and the sustainability of those healthcare systems we knew was going to be a problem. What we did not know is how little resilient they were going to be. And I give you a few examples. I think supply, demand, matching platforms in the era where consumer platforms like Amazon, Alibaba exist. I mean, there is not such a thing for PPEs or ventilators. I think it was very hard for WHO to even find a supply, and they had to send armies of consultants to China to find those products. I think that's something that can be repaired. Then there is obviously the role of WHO itself that has been questioned during the crisis. I think they've done fantastic. They have delivered fantastically on many, many things, but we will have to reflect moving forward. What's really the role? Is this a normative body? Is this a research organization? Or is this a response body? Are they having the resources and the right means to actually be a response body? That's a key question. We had discussions before on equity and access. I think at this point in time, when we talk to vaccines, 9 billion doses of vaccines has been pledged to less than 50 countries. That's a big, big, big worry. I think there is a fundamental question of equity there. And when we talk about equity, this is also true when it comes to underserved population and the poorest that are disproportionately affected by the disease. The ones with chronic disease are having a death toll 10 times higher than the ones that are free of disease. That's something that show and cast a spotlight on disparities and inequity. And the Deputy Governor also mentioned the lack of usage of technology. There are some progress in the use of technology. It's true, we've seen quite a bit of an improvement when it comes to access to virtual care and virtual medicine, and it's been pretty much global. But think about that. Since 2008, there is an organization that's called the GIS-AID, the Global Initiative for Sharing All Influenza Data. And this organization is mapping the mutations of flu viruses on a quasi-daily basis for research purposes to help pharmaceutical industries to actually adjust their annual vaccines or perfect their annual vaccines. And in that context where genomics analysis is available, we still have an alarm system where a country needs to report to WHO. It takes 1 month when there is an incident on the soil, and WHO takes another month to tell the world. I mean, this alarm system needs to be fundamentally reformed, and there are ways to do it in the time where technologies from the fourth industrial revolution, including genomics and artificial intelligence and data analysis, can be used. I would like to pause there. We have a few ideas when it comes to improving those mechanisms at the World Economic Forum, and I would be very happy to share some of those ideas with participants today. Over to you, Artricia.
Thank you so much, Mr. Arno. So definitely, I think by your saying how 75% of pandemics are linked to animal diseases as well as even climate change, this gave us a better hope to anticipate the future of potential outbreaks, right? So definitely in the Q&A session that is happening right now, I would like to ask you, as government as well as the private sector players who are definitely watching us at home, how can we best direct our investment as well as our resources to which health portfolio would be most urgent? But the first question I would like to ask Ibu Suharti Sutar, our Deputy Governor for Population and Settlement Control. So Ibu Harti, the question is as follows. The health of a city's people is definitely at the heart of all urban living. However, as health is a public good, market failure could definitely occur, and therefore the government intervention through funding, subsidies are most important to serve our public interests. So the question is, how can a more collaborative urban health, rather a simply or a merely government-centered one, be well enabled in the city? And how to find the balance between market and public interest? Could you give us some examples, please?
Okay, thank you for the questions, Atricia. For sure, we cannot anymore rely solely on our own government's revenue to do all the development, including implementing this urban public health system. So we need to provide an opportunity for the community to contribute to our velocity through the collaborations or through public-private partnerships. So in these schemes, the government should play as a role as regulators that monitors and supervising the and to ensure that the private services can deliver according to the regulations. Of course, to make sure that the collaboration programs can work, balancing public and private interest is needed. So it needs a willingness of the governments to adjust the regulations. And involving stakeholders from the very beginning of the states in planning. So, for example, we have done actually in the slum area revitalizations, communities involved in the designing the action plan, we call it CAP, and furthermore executed through a collaborative implementation program. Sure, it is guided by experts. They cannot do it by themselves. And the budgets for the implementations can also be from the governments and also supported by private sectors. We also have another examples like school feeding programs that we have done quite along, where the budget now is fully managed by the community. Even the budget is from the city government that is allocated through the schools, but it's managed by the community. And in addition, implementing urban public health system doesn't call for a special budget, but can be done through mainstreaming existing programs, such as in water and sanitation programs, waste management, even housing, so like what Prof. Pangestu mentioned earlier, and even transportations that provide better access for people to do physical activities like to go walking or go biking, and it is important also to do active communications to the societies and private sectors to shift again the paradigm from healthcare to care for health by promoting healthy lifestyles and providing public facilities. For example, the activations of green space in Jakarta, lots of taman-taman, we can use it for the exercise and also bike lines. So we could even do it through mainstreaming in the curriculum at schools, for example. So children from early age, they can be promoted to have a healthy lifestyle. Thank you, Atricia.
Yes, Ibu, and I think in addition to mainstreaming the urban health component or benchmarks into all of DKI Jakarta's program, it is also significant to note about our efforts during the pandemic, such as the large-scale social collaboration, or the KSBB that we've done and has amounted thousands, if not hundreds of thousands, health as well as logistical efforts and facilities to overcoming the pandemic, right, Ibu? Yeah. So it is very important, and collaboration is definitely the crux or the key of all of our efforts. So I think I would like to direct the second question to Professor Pang on transparency and being a data-driven government, basically. So I read in a lot of your interviews, you mentioned how scientific literacy is a very key component in policymaking, right? So the question is, one of the many lessons that we have learned from the COVID-19 is the importance of data-driven policymaking. This will involve not only the government, but also academia, grassroots institutions, as well as the civic public as a whole. So the question is, how can we more effectively collaborate to encourage an evidence-based health policy development, as well as how can we better promote transparency in future health research?
Yes, obviously, that's a very important question. You know, I'm a scientist by training, and I always tell people that are making policy, your starting point should always be evidence and data. Yeah. Now, having said that, a policymaker has to deal with so many other factors as well. Yes, evidence and data is important, but in the policymaker world, there are so many other things that he or she has to take into account. But in terms of the data and the evidence, as Arno mentioned, there are a lot of innovations now in terms of artificial intelligence, big data analytics, machine learning, mathematical modeling. So the data is becoming more powerful, much better analysis. So the quality and the quantity is increasing. The question is, as you said, how do you bridge the gap between the people, the scientists, the academics who collect and analyze the data, and the policymakers? And the key issue here, as Ibu Suharti mentioned, is speed, transparency, and accountability. So in my view, the best way to do this is to have an open, regular platform for communication and dialogue between the scientists, the researchers, the academia, the policymakers, and policymakers, not just at the national level, but at the provincial, even at the district level, because they are the ones who are key in implementing policy. And obviously, you also need to involve communities, civil society, local neighborhoods, even. In Indonesia, you talk about lurah, you talk about kepala RT, kepala RW. Okay, so a regular platform to talk about data and evidence in a transparent way, in a rapid, sort of timely manner is absolutely important to sort of, the underlying thing here is to build trust between all the three constituencies that are at the end responsible. It's not just about policymakers, it's not about just the data, it's about social responsibility. In Indonesian, we would say kesadaran dan tanggung jawab sosial. Thank you, Atisha.
Thank you so much, Professor Pang. So just to note on your very important last sentence is that trust in government, in good governance is very important. And if anything, it triggers the social capital that we need so much, which is people's trust in our policies and the strategy that we have in handling COVID-19 pandemic and beyond. So with that, I would like to direct the third question to Mr. Arno. Professor Pang, you mentioned how there is this need for collaboration and a very open platform, right? And I believe that kind of platform could be initiated and empowered and enabled by the development of technology. And as Ibu Harti said, the government is best suited as a regulator. A lot of time, innovation happens elsewhere, in university classes, in startups, and the private sector as a whole, for example. So, Mr. Arno, my question to you, with the pandemic stretching the limits of our healthcare systems, namely, for example, our hospital bed capacity and the number of healthcare workers that are available, and the general public now has become much more aware of the importance of public health. The question is, where should we place our priorities when it comes to investing in health? Is it on our technologies? Is it on our health insurance? Is it the hospital bed expansion? So I'm very curious to hear that. And with that, I hand it over to you, Mr. Arno.
Yes, thank you very much. That's a very good question. I think it's a little bit of both, or a lot of both. I think to the Professor Pang mention on data, I think there is certainly an opportunity at this point in time to create this type of an open registry of pandemics anticipation relevant data. One of the ideas that partners of the World Economic Forum have offered is, for instance, if we would create an academic and healthcare delivery network of, say, 250 sites or hospitals and academic centers, globally connected, and every time a pathogen that would be unknown would be mapped from a DNA standpoint against registries of known disease, animal and human diseases, you would have a very, very different alarm system from the one that is the one of today, where, again, it's voluntary reporting from member states to WHO and from WHO to the rest of the world. That's a very, very practical idea. And I can tell you it would not cost massive amount of money because all the technology is available. We can do fast DNA analysis of pathogens for a fraction of what the cost was 10 years ago. But you know, this technology angle will not be, in my view, a substitute to building capacity. I think, like it was mentioned before, diversion of care in the current crisis has been a huge problem, and we've been talking about TB, malaria. I would mention also hepatitis. Think about the fact that every 1 month of a delay of a cancer diagnosis, and it was published in the British Medical Journal, every 1 month of a delay affects the fatality rate for the disease by 6 to 13%, depending on the type of cancer, meaning that 6 to 13% more death for every 1 month of a delay of a cancer diagnosis. This is not going to be solved by technologies. This is a question of access. And the two things are, yes, invest in technology, but also invest in parallel into capacity. You know, if you think about the amount of stimulus money that is being injected into global economies at this point in time, there are some good analysis of that. If only 1% of those stimulus monies were going to be invested into healthcare system, we would actually fix a lot of those capacity issues, 1% only. So I think it's about government courage and decision about investing into healthcare system and as part of those very, very large stimulus packages.
Thank you so much, Mr. Arno. So you mentioned how there's this importance and urgency on creating a registry or a repository of knowledge, a database that is continuously updated by member states as well as by experts, so that we can anticipate as well as prevent and respond best to future outbreaks and future diseases in general, right? And Ibu Harty, I would like to shift it over to you because I think Mr. Arno as well as Professor Pang touched a lot on research collaboration, and I believe you would like to share a little bit about what Jakarta has done in that regard, please.
Yeah, I cannot agree more with the two panelists about the importance of the data and research. And for the information, Professor Pangestu and Mr. Barnett, we already collaborate in the research with universities in Indonesia, namely University of Indonesia, and also with the NTU, Professor Zulfikar Amir, that also do research in Jakarta. So we provide the data that they need, and we get the information, recommendations, what Jakarta need to do next in this issue in pandemic. And other than that, as Professor Pangestu also mentions, the need of the detailed data until RT/RW data, we have that, and we provide it even for the Army and the Police Department, so that they could help us in coping and managing the COVID at a local level. So by doing so, everyone's becomes very trust us in the managing our crisis in Jakarta. Again, data is important, and science help us a lot in guiding us what need to do. There's some information from Jakarta, Ica. Thank you.
Thank you so much, Ibu Harti. Just briefly before we close, Professor Pang and Mr. Arno, do you have anything to add to Ibu Harti's findings and sharings just now?
Please do. We need lots of thought.
Yeah, I mean, I would just for my final comments, basically say that once again, it really is to continue to pay strong emphasis on science, on data, and on evidence. Just two quick comments on what Arno mentioned earlier. I think the idea of a register is a very good one. I would add to this because, as Arno probably indicated, that a lot of these pathogens in the future as well will come from animal sources. The monitoring and the registry should include these wildlife markets that are very, very common in parts of Indonesia, in parts of Thailand, where wild animals are sold and consumed as food. Like 70 to 80% of pathogens come from these wild animal sources. So your monitoring must also include monitoring those markets as well as some regulations to probably limit, the consumption of wildlife, because that, at the end of the day, is going to be your source of future outbreaks. Just my final comment is to, once again, Atricia, to refer to what you said. At the center of all this is good governance, together with social capital and obviously with resilient healthcare systems. Thank you.
Thank you so much, most definitely. Mr. Arno.
Yeah, I cannot agree. I cannot agree more with Professor Pang on the need to also monitor those sources of virus. But the one thing I would like to add in a true multi-stakeholder approach, I think it's unlikely that the vaccines are going to be equitably distributed. We are facing that allocation of vaccines by way of bilateral agreements that has not been optimal, far from it, despite the effort of COVAX. So my wish is that we don't overly rely on vaccines in the short term, and we continue to actually utilize social distanciation measures and protective measures that have been proven helpful in the past, and certainly, I think the importance of diagnosis in the next year and maybe the next 2 years is going to be paramount. So I think let's not forget that diagnosis is and contact tracing is the best practice, and it will be the best practice for many months to come, especially as antigen tests are going to be developed that are going to be less expensive. Think about having possibly in the next months $2 or $3 a test, lateral flow antigen that would be saliva based. That would be a profound game changer, and maybe even more than the vaccine discussion we are having today.
Thank you so much.
Atricia, can I just quickly add a very important point? And I want to really pick up on what Arno said earlier, the importance of government having the courage to make important decisions. Now, that is such a critical issue moving forward. Now, critical decisions refer to, as Arno mentioned, when you talk about stimulus package, don't worry just about saving jobs. Worry about some of the stimulus going to strengthening healthcare system. Another courage is required is to make tough decisions about restrictions whenever there's an outbreak. Okay, these are difficult choices for governments to make. And there's a saying, what is popular is not always right, and what is right is not always popular. So that's the challenge for our policymakers. Sorry, thank you. I just couldn't resist adding that point.
Thank you for the advice, Professor Pangestu and Mr. Barnett. That's very important for us here.
Yes, so definitely, Bu Harti, I think it's very important, and it would serve as a very good compass on our day-to-day work in the future, right, at the City Hall. It's very important how making the right choices, making the most courageous choices, although it might not be received popularly on the ground by the people, is key here in dealing with the pandemic and beyond. So we're still very good on time, actually. But I think we would like to close this discussion. It has been terrific talking to you all. Thank you definitely for the opportunity to moderate this session. I have really learned a lot and definitely would love to implement the lessons learned and the insights shared into my day-to-day work back for the COVID management. So thank you so much. Amelia, back to you.
Thank you so much, Atricia, for wonderfully moderating this session. And we'd like to thank our speakers for your excellent input on the policy discussion on public health. I hope their audience has gained incredible insights from our speakers as well as moderator. And if there's one thing that I can take from this policy discussion on public health from our speakers, they have continuously emphasized that the best protection for public health truly is prevention and not cleanup. And we truly have been learning so many lessons from 2020, and I hope that we'll leave this year knowing that we've done our best and enter 2021 more prepared and to stay more vigilant. Thank you so much, everyone. And that was our policy discussion on public health. And next, let us talk about the realms of governance and urban policy and how Jakarta will adapt after the COVID-19 pandemic.